All right, guys, we're going to be going over Americo's Eagle Select series. This is not their advantage participating whole life. This is going to be their simplified issue, instant decision whole life. Okay, let's jump into it. Now, they have three different rate classes. Okay, the first rate class is their Eagle Select 1, which is a preferred rating. It's a level death benefit with issue ages 40 to 85 and coverages from 5K to 50K. Okay. And that pretty much is the same thing for their standard rating at Eagle Select 2, the level death benefit with issue ages of 40 to 85 and 5K to 50K for the coverage amount. Really what they do between the two, it's really just a premium. Okay. Instead of penalizing the policy like they do with the Select 3 and the graded, they just penalize the premium, make the client pay just a little bit more to combat that risk class. Okay. Now, Eagle Select 3, this is their graded. Okay, it works just like your typical modified plan. Um, Years 1 through 2, it's going to be return of premium plus 10%, and then in once year 3 hits, it's going to be the full 100% of the death benefit, with issue ages of 40 to 75, and then death benefits of 5K to 25K. Now there are a few different riders and benefits, as well as other incentives that go along with this plan. It comes with an accidental death benefit rider. It's a double accidental. Um, as long as it's labeled an accident and not a natural death, this is payable. Okay, and then it comes with the accelerated death benefit rider up to 50%, with terminal illness, nursing home confinement, and hospice care being the listed reasons to apply for that accelerated death benefit. Um, Now, this company offers something that not many other companies offer, and it's called early coverage. Okay, it's a benefit that applies to all Americo products on their all Americo Eagle products for their simplified issue whole life. Clients are actually insured for the entire coverage amount on issue. So as soon as that policy is issued to the client, they're covered for the full death benefit, regardless of how they pass, whether it be accident or natural death. However, you're still going to be in contestability, so be sure on that. There's some discrepancies on the application. Maybe uh, something was marked wrong or something like that, and it was still accepted. Be sure to check on that as well, for your clients. Now, the child and grandchild term rider. Okay, it's a little bit different than like the children's whole life with Mutual of Omaha. There's a level term insurance for the insured's child, up to age 25. Okay, you can only add up to 10 children on this at one time. The coverage per child is insured in the units of 1,000 and must be the same for all insured children. So you can't have one child with 1,000 and one child with 5,000. Okay, and the maximum coverage per child is lesser of 5,000 or base policy amount. Okay, so you can't have more term insurance on the child than you have on yourself. Okay, you can't have like a $10,000 policy and have 20,000 in term insurance for the children. Okay, it's not going to work like that. Okay, um, a lot of folks used to do that to kind of get around having a big policy or doing an individual term policy for children. So that's how they got around that. Now the coverage does expire on the insured's 25th birthday. It doesn't matter if you got the client, the grandchild term rider when the child was 15 days old or 17 years old. It's going to expire on their 25th birthday. Okay. Now, the child and grandchild term riders eligibility is in between 15 days old to 17 years old. Okay. And it has to be a natural grandchild, stepchild, or a legally adopted child or base insured, child of the base insured. So it can't be like Aunt Susan taking out a policy on you. Okay. That's not how it works. Now, this is one of the biggest reasons why we use Americo. Okay, versus like Mutual of Omaha. All right, because Americo and Mutual of Omaha, they're pretty competitive on premium. So if we're looking at somebody who's a smoker and who is trying to quit, we use their quit smoking advantage plan with Americo. It gives them 3 years to quit. Um, must quit for the entire third year. Sorry, that was a typo. Um, and then the premium, or coverage increases if still smoking. Okay, there's three different options. Option A, if the client is still smoking, the premium rate per thousand will change to the nicotine rate of the age of issue starting year 4. Once year 4 starting, If they're still smoking, what they're going to do is they're going to look all the way back to when this policy was first taken out. They're going to find what the smoker rate was for the death benefit they applied for, and they're going to change that rate to that for the insured's death benefit. Okay, so the premium rate will increase to that rate. Option B, it's the opposite. Okay, the death benefit will be reduced to the smoker amount associated with the smoker's premium from the issue age. So instead of adjusting the premium, they're going to adjust the death benefit and reduce it down to what it would have been if they applied for the smoker rate back on the issue date. Okay, and then let's say they stopped smoking. They quit smoking for an entire year. Congratulations. Option C is nothing changes. They get to keep that premium as long as they don't start smoking again. Okay, so that's huge. So if your client's looking for a reason to quit smoking, give them a financial incentive. Plus, Americo is one of the best products out there. So some automatic declines with Americo. Okay, there's a bunch. Okay, organ or tissue transplant, multiple sclerosis or MS, systemic lupus, ALS or Lou Gehrig's disease, Alzheimer's or dementia, Huntington's disease, brain tumor, Parkinson's, which is kind of annoying, but it makes sense. Amputation due to disease, liver disease, and then any of these in the last 12 months is going to be needing help with activities of daily living, receiving hospice care, use supplemental oxygen for breathing, or dependent on a wheelchair or motorized mobility device. Now, Eagle Select One. These are the common accepted conditions. Okay. Felonies, there's a 2-year look back as long as they're not on probation or parole. They'll accept AFib, bipolar, depending on meds, blood clots at all. 3-year look back on cancer, skin cancer ever. They could have just got it removed yesterday and be able to get a day one plan with Americo. COPD without tobacco, and they have to be a true non-smoker. The quit smoking advantage plan isn't going to work in this. They know if they smoke or not because you mark it on the application. So if they're a true non-smoker, they'll accept COPD without tobacco. Okay. However, if they do smoke tobacco currently, even with the quit smoking advantage plan, it'll still push it standard, unfortunately. Um, Being diabetic and diagnosed after the age of 45. If before 45, we're gonna be looking at a different carrier, but after 45, we're good. Um, Heart attack, there's a 2-year look back. Kidney disease, a 4-year look back if it's untreated. Um, They'll accept non-systemic lupus, a pacemaker installed with a 2-year look back. Schizophrenia, that's med dependent. Some meds will actually push it to either standard graded or an automatic decline, depending on the medication. They'll accept seizures, stents with the 12-year look back, TIAs with the 12-year look back. Um, Wheelchair use they'll accept as long as they don't need help with activities of daily living. A lot of times folks are in like a wheelchair or a scooter because they broke their leg or something like that. Okay, that's fine. The carrier understands. So certain situation happening to reason why they need these things to maneuver. That's okay. Okay. As long as they don't need help with ADLs, they'll accept you. But they're very forgiving when it comes to anxiety and depression, as well as MDD, which is major depressive disorder. That is med dependent as well. And then they also accept some pain, narcotics, and opiates. Okay, some of them are an automatic decline, but some of them are not. So make sure you consult your coach or Americo, an underwriter to kind of check on those medications. Okay, because unfortunately they don't have a medication guide. Um, I'm not really sure when they're going to come out with one, but they don't. And then they also have a 2-year look back on angina as well as Hep C. Okay. Now, Eagle Select 2, this is their standard rating. Okay. Common accepted conditions. There's a lot less, um, which is why we don't typically go this route. But they'll angina between 12 and 24 months, we're going to be able to get their standard rating or their Select 2. Okay. Option B. Or Hep C within 2 years, within diagnosis to 2 years, we're going to be able to get their standard rating. Kidney disease 2 to 4 years, stroke 12-year look back or 12-month look back. As long as they're not a smoker, a true non-smoker. Okay, if they are a smoker, it's a decline. Okay, cannot smoke while having a stroke history. It will be an automatic decline with Americo. and then TIAs within 12 months will go standard. Now graded, they're select three. Okay, accepted conditions for them: cirrhosis within 2 years, liver disease, diabetic complications, uh, heart attack 12 to 24 months, and then kidney disease if treated within 2 years. Now, this is their build chart, okay? They don't show BMI, but if you're looking, trying to find your client, say they're 5'1", between 93 and 224 pounds, you're going to be good to apply with Americo, okay? They don't discriminate based on uh, rating. So some carriers, like if you have a certain BMI, you can only get this rating. It doesn't matter, okay? If you fit within this category, like 5 foot, between 90 and 217 pounds, you can apply for any rating with Americo, which is awesome. So make sure you're looking at that when you're looking at your client's height, weight. If they follow one of these categories, make sure you act accordingly. Maybe you have to switch to like Royal Neighbors if they have too high or too low of a BMI. But that's all I got for you when it comes to Americo. They're one of my favorites because they accept so much on their preferred rating. And then that quit smoking advantage plan is killer, especially when you're competing with like Trans America. Maybe the client has COPD and they smoke. You know that's going to go standard. Or you can go Trans America, but you're like, oh, man, I really need to worry about premium with this client. They got a low budget on a fixed income. Cool. You could save like anywhere between like $5-10 a month by going Americo, as long as they promise to quit smoking. Otherwise, obviously, their premium is going to increase. So make sure you let them know about that. Get that disclaimer. Um, but that's pretty much all I got when it comes to Americo. I'll see you guys in the next one.